I've been told that the best way to get toned is to lift as if you're trying to become a bodybuilder. You won't accidentally become a bodybuilder, I promise. Okay, like that doesn't happen.
Don't want that.
You were telling you're telling the camera person today that you don't think you really can be cracked. Is that correct? Or?
Yes.
Okay. Over. I think that's just going. Yeah. Lovely job.
Oh, my reflexes are like a cat.
I hope so.
They are.
Meow.
Today we've got a patient who was very nervous about seeing a chiropractor. She's never seen any manual therapist before. That's a physio, osteo, massage therapist, nothing. So this is her first time seeing someone for an upper trap / neck tight pain. As usual, I'm going to ask that you please click that subscribe button down below. It really helps with the algorithm a lot. Again, thank you so much. I appreciate you and enjoy the video. Maisha,
Thanks.
Very good to meet you. So Maisha's never seen any kind of manual practitioner today, which is really exciting. She's nervous, but we're going to take things one step at a time. Maisha, what are you kind of in for today? Do you have any like acute complaints at the moment, or?
Sometimes my shoulder and
Okay.
my back is a little sore
Okay.
occasionally.
Where in the back? Upper back, lower back?
Upper back, I'd
Upper
say,
back
yeah.
for sure.
Yeah.
Okay, and shoulder. Are you able to point to where in the shoulder exactly? Can we see that from that angle there?
Yeah.
No? So what are we... Okay, so we're really
Right
pointing
in
kind of
this
in the
area,
back
yeah.
area. Anything kind of in the front aspect at all, or is it really only in the back?
Only in the back.
Okay,
yeah.
so we're looking more like upper trap, left scap in that region, not so much the shoulder itself. But I can understand why you would put that as shoulder.
Yeah.
So you kind of got that upper back issue, that shoulder issue. Any idea where that might be coming from at all?
I worked at a bubble tea shop for 3 years, and
Okay.
I did a lot of like movement of the one arm.
Okay.
So after that, it started.
Bubble
so.
tea. My sister is obsessed with bubble tea. Which shop was it?
Chat time.
Chai Time. Is the one nearby, or?
I live in Guelph. So.
Okay, so a bit of a drive, All the same. So now you're not working there anymore. What are you doing now? Is it like a desk job? Because usually that kind of issue is associated with a desk job.
Yes.
Yeah.
Yeah. A desk job.
Okay. Can I ask what that is?
Yeah, as a creative assistant.
Creative assistant.
And then also communications officer.
Fair,
So
okay.
At a desk all day.
So yeah, that
Yeah.
does sound like a lot of desk work. Why haven't you seen anybody like a physio or a massage therapist or anything in the past?
I don't know. I've never really thought to go. I
Fair,
think is
alright,
the main
yeah.
things.
You're how old now?
I'm 24.
You're 24. Okay. When's your birthday? When do you turn 25?
September 12th.
September. Okay. So 25, I feel, is that magical age where things start to hurt a lot more. All right. So it's good that you're getting in now. Okay.
Yeah.
I felt like I was invincible until I turned 25, and then my knees started to hurt, and I started getting neck pain. But I hope you'll find benefit from this. If not now, then in the future. Okay.
Right.
So to that end, let's kind of get into the physical exam here. So I know that you were saying that your issue predominantly is this right upper trap here, right? I'm
Yeah.
just going to kind of, you okay if I just move your hair out of the way here?
Yeah, you're
Perfect.
good.
All right. So we're going to start by doing a range of motion exam. I need you to rotate your head as far as you can to the right for me, please. As far as you can go. That's, okay, so we get to about 80 degrees there. Now as far to the left, please. So here we can get to 90. So there's a little bit of a decrease on the right side. It's not that much, but it is noticeable if you're looking for it. I get you to tilt your right ear to your right shoulder for me, please. Good. Here we can get to about 50. Good. Now left ear to left shoulder. Good. What kind of hobbies do you have in your free time if you're not working?
I go to the gym.
Okay, you seem quite mobile, so I don't know. Is it like a Pilates thing? Is it resistance training? Like,
Running and weights.
okay, running and weights. Fingers curled. Fingers curled. Good. Strong. Grr. There we go. And grr. I don't know why, but I want to say grr. That seems to help patients be a lot stronger. You know, some of the tiger within or something. Literally does. Good. Finger twitch. Good. Wrist twitch. And you can drop this. Have you ever had this done before?
No.
No? Drop that arm. When was the last time you saw your medical doctor?
A really long time
Really
ago.
long time ago. Hey, that's okay. I mean, you're young and you're invincible right now.
Yeah.
Relax this arm. Good. Good. Finger twitch. Good. Twitch. And then drop that arm into my hand. Give me the full weight. That's not the full weight.
No.
See that you're supporting it? There you go. Full weight. Good. There we go. That's better. And good. There we go. That's a clean upper limb neuro exam. Let's kind of do a little bit of massage work in through her upper back here. I'm going to get you to look up and to the right for me, please. Good. And now I'm going to take an elbow and put it right there and get you to slowly look down and to the left, okay? I can't see her face. Is she wincing? Is that a little bit too... No, she's tough. She's strong. Good. Down to the left. Ooh. Do you feel that right there? That big knot?
A little bit, yeah.
A little bit? How's that only a little bit? You gotta be one of the toughest people I've met. Okay, I'm sorry. This is usually when people start to tear up a little bit. Up and to the right, yeah, and slowly down to the left. Okay. So you definitely got a tighter upper back here, okay, and I kind of feel it all throughout. Now you've never been adjusted before, right?
No.
In fact, you're telling the camera person today that you don't think you really can be cracked. Is that correct? Or?
Yes.
Okay. Okay. So my ego is on the line here, which means that we I'm sure we can make it go, but we're going to be nice and gentle as we usually are. So, to that end, in order to get this to go, I'm going to need you to take a big breath in for me, and I want you to breathe all the way out, nice and slow, all the way out. Yep. Good. All right. So did you feel that?
Yeah, a little bit.
Did that hurt at all?
No.
No, exactly. That's what an adjustment is, okay? Do you have a goal in the gym at all, or not particularly? Just go to be active.
Just get really toned is the goal.
Toned.
Yeah.
Love that word, toned. Yeah.
Very hard to do, but.
Oh, incredibly.
Yeah.
I've been told that the best way to get toned is to lift as if you're trying to become a bodybuilder. You won't accidentally become a bodybuilder, I promise.
No.
Okay, that doesn't happen.
Don't want
That's not
that.
how works. It won't happen. Okay, by that logic, just do 10 minutes on the elliptical and you'll be all better. So, I get you to take a big breath in for me one more time. All the way out. There we go. That was a little bit more force, but I hope still gentle.
Yeah.
Okay. So, we're also going to come down into the lower back here. You okay with that here?
Yeah.
Perfect. So the low back, as we get down the spine, we get to the sacrum, which is the bottom of the spine, which connects into the iliums, which are the hip bones proper. So right there would be your sacroiliac joint, okay? The connection between your spine and your hips. Did that just pop right there?
Yeah, it did.
Okay, so she says that she doesn't adjust, but I just did the smallest bit of overpressure and just like that, all right? So I wish I had the mic there so you guys could have heard, but all the same. Okay, so if it really wants to go that badly, I would also go ahead. Ooh, is that tender or ticklish?
No, that tickles.
Tickles. Okay, that's fine. Sometimes you got to distinguish. Good catch, Sid.
Oh my gosh.
Good catch. For someone who's nervous, you're on it. Well
Oh, my
done.
reflexes are like a cat.
I hope so.
They are.
Meow.
My socks.
Now we did get the SI joint, but that makes me wonder if there's more lumbars to go. So for this, I'm going to get you to bring this leg up. You nervous about this one?
I don't know.
All right, well, let's see. Hips towards. Now, what I'm going to do is I'm going to roll you towards me. Okay? You might feel like you're going to fall off the table. I promise you're not going to fall off the table. Okay? So what I'm going to do is just roll you towards me, and I want you to pretend you're going to bed. You're going to sink onto the table there, nice and relaxed. Here we go. How's that? Yeah, that's her face right there. I love it. Okay, pull it over. I think that's just going. Oh, one more. Sink, sink, sink. Relax. You're going to bed, going to bed. There we go. All right. Good job. So I'm going to go ahead and feel through because the right trap is where most of your tension you're saying is coming from. Now the traps, as we're very aware of, kind of come up into the neck region, but they're most bulky in the lower aspects. So you're a little bit nervous about having your neck done.
Yeah.
Understandably so. If you've never had this done before, it's a little bit freaky. I remember when I was learning how to do it with other students, we were all a little bit scared at first because it's not really something that you see every day unless it also happens to be your career, right? So let me just do a little bit more soft tissue work for you here, okay? So to that end, I need you to pretend that this is a pillow down here and you're just trying to go to bed. Good. Once again, pillow, 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 pillow. Do you push your head into your pillow? I don't think
No,
you do,
yeah,
right?
you're
No.
right.
Yeah.
Wow.
Love that. That was great. You still with us?
Yep.
Did that hurt?
No.
Did it feel weird?
Yes.
Yeah.
Yeah.
Okay. Exactly. Right. So let's go ahead and feel through now because that was a lot. Okay. In my opinion, that really needed to go. And now, as I feel through, you know the kind of explanation of palpation that I gave you, where I feel through the other side to see if the other side feels like it's more restricted now. I kind of am getting that because the left side now feels worse than the right, but the same as it did before. Okay,
Right.
so I would also, I know your issue's predominantly on the right, but I would also want to free up the left so that everything is kind of freed. Does that make sense to you?
Yes.
Okay, can we do the left side today?
Yes.
Perfect, all right. I'm proud of you. You were nervous. Yeah, you did great. Okay, same concept. So you're going to turn your head to the right, and you're going to pretend you're laying on a pillow, not pushing your head into it. Good. Lovely job. Cool. Yeah. Why did it take you so long to come on in? Usually at this time is when I like to ask the patient something about themselves which they're kind of proud of or something exciting that they've done. You seemed a little humble about it, but you were working for a non-profit in Uganda this past summer.
Yeah.
That's exciting. Can you share more?
So I was there for 6 months,
Okay.
and I was helping with their Women's Spaces project. So the main thing with that project is helping women with land rights and domestic abuse cases as well. It was pretty crazy.
So sorry, like what is a woman's space? I'm confused. Like
So that's just what they call the project,
okay.
because it is about land rights, and it's a lot of just like letting people know they do have rights to land and they can own a house and things like that. Just because it's part of the culture, it's not very
that's
known.
not very well known
Yeah.
that women are people too.
Yes, yeah,
foreign
exactly.
concept in some places, absolutely foreign.
Yeah.
But, yeah.
Yeah.
Well, how did you fall into that?
It was an internship for after school, because my job there was to help with the social media and the communications
So
of
she's
the
got
whole
credentials.
project.
Yeah, that's good. And I'd imagine that was pretty transformative experience for you.
Yeah, it was really cool. I definitely learned a lot about a different culture and living in a different country. So, yeah, very much enjoyed it.
Well, thanks for sharing. Glad you had that opportunity. Not everybody ever really gets to travel to any other part of the world. When they do, it's usually, at least in this area, like a beach or like something super relaxing, right? That could be very eye-opening and could probably offer you a lot more perspective than another person who would never get that opportunity. So make sure you keep that close to heart and keep it in mind anytime you're thankful for things going on here.
Yeah, no, that was one thing. It definitely makes you thankful for what you have.
Good.
So
So we are getting a little bit of that petechiae in through here that I was talking about. Okay, it's not too bad. I'd say this is a mild to moderate amount. Okay, I was actually expecting a little bit more, but you can be thankful that it's not absolutely morbid back here. Okay. Also, when you go home, you might want to let your parents or your partner or whoever it is that you live with know about it, because usually it's them who freak out about this, not the actual patient. So yeah.
Yeah, I'll definitely let them know.
Okay, perfect. Yeah. Don't want them coming at me with lawyers. Hasn't happened yet, but we do live in a place where people can afford lawyers. So sorry, I'm actually just gonna put this over there.
Yeah.
We have massage, we've Graston, or I guess this is soft tissue therapy, we've adjusted, and now we're finishing up with some massage again here. But overall, again, I don't think she's a very concerning patient. It's very normal to get that upper back kind of tension, especially if you're working a desk job. Does this feel okay, by the way? It's not like painful at all? Perfect. If this is you, alright, if you're the kind of person who has a complaint like this, and it's getting in the way of you being able to work longer hours or do things that you want to do, highly recommend that you see some form of manual practitioner. In this case, you saw a chiro, but you can see anyone. You can see an osteo, a physio, a massage therapist. We're all pretty good at taking care of that for you. Okay, well, there we are. That concludes everything that I would do for you for the time being. Did you? Hey, I turned you off. Why are you? There we go. All right. Did you have any other questions for me, or is there anything else that you'd like to talk about for now? Any concerns?
I have one issue with my ankle.
What's up
I don't
with
know
your
if
ankle?
that's something that I feel like it's a tendon. I twisted it once when I was traveling and never went to the hospital.
Where can you point to where in the ankle?
Right there.
Right on the kind of outside or the lateral aspect, kind of not right at the bottom of the fib head, but more off to the front there.
Exactly,
Okay.
yeah.
So that is right on top of the anterior tibiofibular ligament, also known as the ATFL. It is the most common ligament sprained on ankle rollings.
Okay.
How long ago did that happen?
It was like 4 years ago.
4 years ago, and it's still it's still giving you grief?
Yeah, it flares up sometimes.
Okay. Was it like a really bad sprain, or?
I don't know, because I didn't go to the doctor or anything. Cause
How long was it like severely bothering you for, or acutely rather?
I was traveling for a month, so I would say about a month.
About a month.
Yeah.
Okay. Was it purple? Like when you first was there noticeable swelling?
Like blue, and it was noticeably swollen.
Noticeable
for sure.
swollen for a while. Okay.
Yeah.
When you get severe swelling on an ankle rolling injury like that, it tells me that it's a sprain, but it might be more of a severe sprain and something you should get looked at, right? If you do kind of just let it ride, that can create instability over the long time if you never rehab it back, okay? Yeah, that's something that I can treat here, no problem, okay? But at this point, if it happened 4 years ago and it's still bothering you, you're going to be looking a lot more at like an ankle strengthening plan rather than just to let me pull on it and it's better, right? So if it's an acute strain or sprain or whatever, yeah, we can handle that just with passive modalities. But if you let something go for that long, you need to rebuild back strength and proprioception within that ankle. Do you find that that ankle feels unstable for you?
Yeah, it feels stiff a lot of the time.
Feels stiff too, right? Okay.
Yeah, it doesn't roll as much as this one.
Well, that's actually good.
Yeah.
Okay, that's good that you haven't consistently kept re-aggravating it.
Yeah.
But yeah, we can absolutely do an exam for that and see what we can do for it. Not today, unfortunately, we gotta do, but like next time, absolutely 100%.
Okay,
It's in
perfect.
the ballpark. Yeah. Any other questions at all?
No.
No.
just
All right.
that.
Well,
Perfect.
thank you so much for coming in today. You were very brave. It was good to
Thank
meet
you.
you,
Yeah,
and
good
I'll
to
see you
meet you.
soon.